During the cold months, long before antibiotics and modern respiratory treatments, physicians had a surprisingly straightforward method to help patients recover from coughs, bronchitis, and other chest ailments. They emphasized a careful winter airing routine, an approach that combined controlled exposure to fresh air, regulated warmth, and attentive monitoring of the patient's condition. For history enthusiasts and survivalists, understanding and applying these routines offers both a fascinating glimpse into historical medical practice and a practical, low-tech approach to respiratory health. Doctors instructed patients to keep the bedroom well ventilated even in freezing temperatures. Physicians in the early 20th century were adamant about the dangers of stale indoor air. They recommended opening windows several inches during the day to allow a continuous exchange of fresh air. This was not done indiscriminately. The key was to avoid drafts directly on the patient's body. Beds were positioned away from windows, often with a foot or headboard buffer, and sometimes with a curtain or blanket drape to moderate airflow. Even in sub-zero temperatures, a controlled stream of fresh air was believed to help the lungs expel mucus and reduce the buildup of pathogens that thrive in enclosed humid conditions. Patients were gradually exposed to colder air to strengthen the lungs. The airing routine wasn't just about keeping the room from feeling stuffy, it was a deliberate method to gently challenge the respiratory system. Doctors would sometimes recommend sitting near an open window for short intervals while dressed warmly in layers. For those bedridden, blankets could be pulled back briefly to allow a rush of cool air over the chest. The idea was to condition the lungs, improve circulation, and enhance oxygen intake. Modern respiratory therapists note that mild cold air exposure, when done carefully, can stimulate deeper breathing and increase lung efficiency, principles that echo these historical practices. Regular airing sessions were scheduled throughout the day. This wasn't a one-time task. Historical records show patients often followed a routine of airing their rooms 3 or 4 times daily, each session lasting 10 to 30 minutes depending on severity of illness and outdoor temperature. Morning airing helped shake off overnight congestion, while afternoon and early evening sessions supported natural recovery rhythms. Nighttime airing was more cautious. Small window openings or partially drawn curtains were used to maintain warmth while still allowing fresh air circulation. Timing and consistency were considered as important as the airing itself. Now, heating was balanced, not just cranked up to the max. Doctors back in the day actually warned folks about overwarming their rooms. Central heating or big roaring fires. Those were used pretty sparingly, mostly to avoid making the air all dry and overheated, which could honestly make coughing and bronchial irritation way worse. Instead, they kept things moderately warm with layered bedding and personal garments. Patients might wear lined caps or flannel nightshirts while sleeping, which helped preserve body heat without trapping all that stagnant air. For any modern prepper or, historical enthusiast, this really shows an important principle. Combining controlled warmth with good ventilation supports recovery a whole lot better than just blasting constant high heat. Air quality back then was monitored by observation, not fancy instruments. Without thermometers or hygrometers in every home, caregivers had to rely on just paying close attention. If they noticed signs like shivering or blue lips, they'd adjust things right away. And if there was persistent coughing or labored breathing, that meant it was probably time to ease up on the direct airflow. Historical physicians would often tell families to keep the environment consistent and comfortable, but still make sure fresh air could circulate. These days, that might mean something as simple as, positioning beds smartly, using curtains to guide the airflow, or just cracking a window enough to keep a gentle draft instead of a full-on breeze. The routine included gentle movement and chest care. Airing was often paired with light activity. Patients might sit up in bed, perform gentle stretching, or walk short distances in a well-ventilated room. This encouraged circulation and helped clear mucus from the lungs. Historical texts also note the use of warm compresses or poultices on the chest to ease congestion while the room was aired, showing an integrated approach that combined environmental control with direct therapeutic action. Even without access to specialized remedies, recreating this approach at home Short intervals of mild activity and chest care during airing can support lung function during winter respiratory illnesses. Practical application for today's enthusiasts and preppers. For modern survivalists, historical airing routines offer a low-tech, highly practical method for respiratory support. In a cabin or insulated home, open windows strategically to allow airflow without creating drafts directly on occupants. Schedule multiple airing sessions throughout the day, especially during periods of congestion or illness. Combine moderate heat, layered clothing, and chest-covering blankets to maintain comfort while preventing stagnant air. Use short periods of gentle movement or upright positioning to support circulation and lung drainage. For anyone preparing for off-grid living or winter emergencies, mastering the balance between fresh air and warmth is both a historically proven strategy and a practical health measure. The winter airing routine recommended by early physicians shows how simple, disciplined practices can support respiratory health, even in the absence of modern medicine. For history enthusiasts, it offers a window into how people cared for themselves and their families in harsh conditions. For preppers, it provides a practical, low-tech approach that is still relevant today. By understanding and applying these principles, you can enhance your knowledge of historical health practices while equipping yourself for real-world winter readiness. If you found this guide useful, subscribe to Warfield Prepper Chronicles for more in-depth explorations of historical survival skills and practical insights you can apply today. Share this video with fellow history enthusiasts so more people can learn these timeless methods for keeping healthy in winter.